My name is Dr. Ivy B, and you've been referred to me for a full neurological assessment and cranial nerve exam. Okay, so I'm going to get started, and first I'm just going to take some of your medical history. I'm going to confirm a few details here. Can you please confirm your date of birth for me?
January 17th.
Okay. And your first name?
Bella.
Okay. Okay. I'm going to ask you a few questions about your medical history. Do you have any chronic illnesses, diabetes, any heart conditions?
No.
No? Okay. So I read in your chart that you've been feeling a little bit of headaches, migraines, and you've been smelling smells that you know that they're not there, right? Can you tell me what kind of smell have you perceived that you think it's not really there when you smell it?
I would smell smoke.
Okay. Would that smell be tied to the migraines? Like, would you be smelling smoke when you have migraines, or you've noticed it like not necessarily at the same time?
When I'd smell the smoke, I would feel dizzy sometimes.
Okay. Okay, and how often would you say that happens?
At least 2 times a day.
Wow, okay. Any other symptoms that you've been having? Any numbness, tingling sensations, blurry vision, maybe high-pitched noises, something like that?
I would feel very numb.
Okay. Okay. When was your last just general checkup with your primary care physician?
It was last week, but they said that they recommended me to you.
Okay. I'll check your file, make sure that did they do any blood tests?
Yes.
Yeah. Okay, I'll look for those results as well. Okay. A couple other things. Do you smoke, or have you ever smoked?
No.
No. Vaping?
No.
No. Any recreational drugs?
No.
Okay. Do you exercise regularly?
Yes.
Yeah. How many times a week?
4 times a week.
What kind of exercising?
I do cardio and weightlifting.
Okay. Do you ever feel dizzy when you're working out?
Sometimes I have to take breaks because I start smelling the smoke again.
Okay. Okay, so that's all very good. I'm going to start by taking your vital signs. Okay, I'm going to be placing this blood pressure cuff on your arm. I'm going to be placing this on your arm. Sure we don't get your... Okay, you can relax your arm. Okay, so that's 100/95. Perfectly normal. Be placing this on your finger. And I'm going to take your temperature. Okay, 98.3, a little bit on the higher. And we've got 70 beats per minute and 98% oxygen. Okay, so vital signs are all normal. Okay, I'm going to be listening to your heart. Okay, and give me a deep inhale. Okay, one more time. Okay, place this on your back. Inhale. Okay. One more time. Okay. Heart and lung sound all normal, so that's great news. Okay, and now I'm going to start with the smell test. First, I'm going to ask you if you can cover one of your nostrils, take a deep breath, and exhale. I just want to make sure that it's not blocked. Okay, let's try the other side. Oh, okay, very good. So it's both nostrils are clear. Okay, so now we're going to be doing this test. I'm going to be giving you different scents for you to smell, and I'm going to give you 4 options. You can tell me which one you think the smell that you are perceiving corresponds to the option that I'm giving you. So we'll try this one first. For the first 4, I'm going to ask you to cover your right nostril. And then the next ones, I'm going to ask you to cover your left nostril. And then we're going to do some without you covering your nostrils, okay? Okay, so first one, you can go ahead and cover your right nostril for me. Go ahead and take a deep breath. So would you say, I'm going to give you a few options. walnut, banana, coconut, and cherry, or none of these?
None of them.
Okay. Okay, we're gonna try this one again. Cover your right nostril for me. Go ahead and take a deep breath. Exhale. So I'm gonna give you 4 options, and let me know if you think any of them are close to the smell that you perceived. Coffee, wood, smoke, or cigarette?
Wood.
Okay. Okay, so again, cover your right nostril for me. And take a deep breath. Exhale. I'm going to give you 4 options right away. So they're going to be lemon, strawberry, pineapple, or orange.
Orange.
Orange. Okay. And one more time, cover your right nostril for me. Go ahead and take a deep breath. Exhale. So, would you say this smells like coffee, smoke, wood, or cigarette?
Coffee.
Coffee. Okay, very good. Okay, so now we're going to try covering your left nostril. And you can go ahead and take a deep breath. This one should smell fruity. Would you say it's more like strawberry, lemon, pineapple, or orange?
Pineapple.
Okay. Okay, again, cover your left nostril for me. Go ahead and take a deep breath. Would you say this is rose, rum, chamomile, or cookies?
Chamomile.
Chamomile. Okay. Again, let's cover the left nostril. Go ahead and take a deep breath. Does this smell like lemon, apple, orange, or peach?
Lemon.
Okay. And go ahead and cover the left nostril one more time. Take a deep breath. Does it smell like smoke, leather, rose, or lavender?
Lavender.
Okay. Okay, so now you don't have to cover either of your nostrils. Give you just a smell. And the 4 options are vinegar, carrot, garlic, or onion.
Garlic.
Okay, let's try this one. Would you say it's cinnamon, eucalyptus, peppermint, or orange?
Peppermint.
Okay. Let's try this one. So this one, the options are eucalyptus, peppermint, cloves, or garlic.
Peppermint.
Okay. So So this one might be orange, apple, onion, or eucalyptus.
Eucalyptus.
Okay. Okay, so the options for this one are cinnamon, chocolate, honey, or vanilla.
Cinnamon.
Okay, got 3 more to go. Leather, smoke, glue, or grass.
Leather.
Okay. So this one could be chives, mustard, vinegar, or cloves.
Cloves.
Okay. Go ahead and take a deep breath. And this one, the options are wood, smoke, coffee, or cigarette.
Smoke.
Okay. Okay, so we've got 12 out of 16. And you struggled a little bit more when you were covering your right nostril. Okay. Did you feel that that was difficult at all?
A little bit.
A little bit. Okay, I'll be putting this lab. Okay, now I'm going to be checking your mouth. First, I'm just going to take a look inside just to make sure there's nothing that I can detect. Okay. Go ahead and say, Okay. It looks normal. So now we're going to be doing a taste test. Gonna be placing these test strips right on your tongue. And you can tell me if you can detect any taste to it. It might taste salty, it might taste bitter, so just let me know. You can go ahead and close your mouth and taste that. I'll grab it back. No taste.
No taste.
Okay. Okay, so again, let me know if it's bitter, salty, no taste at all, sweet.
That tasted bitter.
Bitter, okay. Okay. Whoop, we lost one. Say that's salty, sweet, bitter, no taste.
Salty.
Salty. Okay.
That was salty.
Salty too. Okay. Okay. I'm going to take a look at your eyes. Okay, first just go ahead and look straight ahead. Okay, just taking a look at your pupils. Okay. Okay, they're consensual and round, reactive to light. Okay, I'm going to be giving you this Snellen chart. You can go ahead and hold it with your hand, just extend it kind of like arm's length, and then go ahead and cover your right eye with your other hand. How does that look? Does it look okay? Can you read all the rows?
Yes.
Okay, can you repeat this row for me starting on your left?
L, T, F, P, H.
Okay, now let's go ahead and switch sides. Does that look the same? Does it look a little bit more blurry?
It's a little bit blurry.
Okay, can you still read all of them though?
Yes.
Can you read the last one starting on the right?
H, P, F, T, L.
Okay, very good. I'm gonna grab this. So Vision's 20/20, even if it's a little bit blurry, you can still see pretty good. You can go ahead and look straight ahead. I'm gonna look at your optic nerve. Just I see that you wear contacts. Okay, that looks, both of them look in perfect shape. Okay, now I'm going to be testing your field of vision. What I'm going to do is I'm going to be using these two objects that are a different color, and I'm going to bring them inside your field of vision. Just let me know when you see it in your field of vision and then what color it is. Okay? Okay, you can just look straight at me. Do you see that right now in your field of vision or not at all?
No.
Okay.
Yeah.
What color is it?
Blue.
Okay. When you see it, you can just say blue or pink. Do you see it right now?
No. Blue.
Okay. Do you see it right there?
No. Pink.
Okay. Do you see it now?
No. Pink.
Okay. Do you see it right now?
No. Blue.
Okay. Do you see it there?
No. Pink.
Okay. Is there one more? Do you see it right now?
Yes.
Do you see it now?
No. Blue.
Okay. Okay, that's pretty good. So now I'm going to be testing your facial sensations. First, I'm going to ask you to just go ahead and relax. I'm going to palpate a little bit around the face. Is that okay?
That's okay.
Okay, just now. Your back. You can go ahead and relax. Just want to make sure that I don't feel any lumps, masses. Okay. Everything feels okay. I'm going to be touching your face with one of these two objects. One's going to feel sharp. I'll show you how that feels. One's going to feel dull. You can just go ahead and tell me what you're feeling, okay?
Okay.
Go ahead and close your eyes, please. Did that feel sharp or dull?
Sharp.
Sharp? Okay. Just keep your eyes closed. You can go ahead and tell me sharp or dull.
Dull.
Okay.
Sharp. 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 Dull. Dull. Sharp. 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 Dull. Dull. Dull.
Okay.
Sharp.
Okay. That's very good. Now I want to make sure that you can perceive changes in temperature as well. You can go ahead and close your eyes. Let me know if this feels cold or warm.
Cold. Warm. Cold. Cold. Warm. Cold. Cold. Warm. Cold. Cold. Cold.
Okay. Okay, so now I'm going to be touching your face with a cotton pad on both sides of the face. Just let me know if it feels the same. Does that feel the same on both sides of your face?
Yes.
Did that feel the same?
Yes. 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 Yes.
Okay, very good. We're going to try with a different texture. Just let me know if it feels the same.
Yes. 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 Yes.
Okay. You can go ahead and I'm going to ask you to stare at my fingers. I'm going to be moving them and just follow them without moving your head. So you're going to follow them just with your eyes, okay?
Okay.
Okay. Okay, can you go ahead and stare right here at my hand? Okay. Other side. Okay, now normal movements of your eyes. Okay, so now I'm going to ask you to look straight at me, and I'm going to hold my fingers in your field of vision. Just let me know if you can see my right or my left fingers moving.
Left. Right. Left. Both. Both. Left. Right. Right. Left. Left. Right. Right. Both.
Okay, very good. Can you go ahead? I'm going to ask you to do a few facial movements, and I just want to test the strength of your muscles on your face. Can you go ahead and clench your teeth for me? Just going to feel for the masseter muscle right here. Okay, that's very good. Now, can you go ahead and give me a big smile? Okay, I'm just feeling your muscles. Okay. Now, I'm gonna hold your eyebrows. Try to lift them against my resistance. Okay, now go ahead and lift your eyebrows. I'm gonna try to push them down, so we'll try not to let me resist. Okay, very good. Now go ahead and try to turn your head towards your left. Okay, now go ahead and try to turn it against my hand. Okay, is there any pain at all?
A little bit on the left.
Okay. Can you go ahead and try to push your tongue against your right cheek? Like that. Left. Okay. Okay. I'm just going to take a few measurements of your face to assess the symmetry. Okay. Just going to place your hair behind your ear right here so it's not in the way. Okay. We'll go ahead and relax. Okay. Face is pretty symmetrical. I'm just going to take the circumference of the head. Okay, 63 centimeters. Okay. Okay. Now I'm going to be checking your ears, and we're going to be doing a hearing test. Just want to make sure there's no blockage. Okay, you can see the tympanic membrane looks normal. Okay, tympanic membrane is periphery as well. Okay, so now we're going to be doing a hearing test. I'm going to ask you to go ahead and close your eyes. I'm going to make a sound with this tuning fork, and just let me know when you hear it. Do you hear this?
I hear it.
You can go ahead and let me know when it stops.
It stopped.
Can you hear this?
Yes.
Okay. Try the other ear. You hear that?
Yes.
Let me know when it stops.
It stopped.
Do you hear this?
Yes.
Okay. Now I'm gonna go ahead and place this right here. You hear that?
No.
Barely. Can you hear that?
Yes.
Would you say it sounds the same on both ears, or do you hear it more on one?
I hear it more on the left.
Okay, let's try one more time. Is it still more on the left?
Yes.
You hear that equally on both sides, or do you not hear it at all?
I don't hear it.
Okay. You hear that?
Yes.
How does it sound? Does it sound the same?
It sounds the same.
Okay. Okay. Now I'm gonna tell you some words. I'm gonna whisper in your ear. Just repeat them for me. I want to make sure that you can hear slight noises. Bland.
Bland.
Okay.
Fabric. Fabric.
Liquid.
Liquid.
Okay.
Bridge.
Chords.
Chords.
Palm tree.
Palm tree.
Okay, very good. So hearing is all normal. And that concludes all the tests that I wanted to do today. On the smell test, we did get a few wrong. We got 12 out of 16. I honestly think that there's no nerve damage. Your cranial nerves are intact. All the tests were positive, had positive results except for that one with the smell test. But overall, I think that that smoke that you've been smelling is related to the migraines. It could happen, you're getting a migraine, even if it's not like full on before you get it. It's possible for you to start smelling smoke. So I'm really not concerned. As long as you can manage the pain from the migraines, you shouldn't have any issues. Would you like a prescription? I can prescribe it's a little bit stronger than what you would find over the counter for migraine, for pain management, or do you think you're managing fine?
Yes.
Would you like the prescription?
I
Okay.
would.
So I'll send the prescription to your pharmacy. You can pick it up there. Just use it with caution. Don't use it when it's absolutely necessary, not all the time. Okay. Do you have any questions for me?
No.
No? Okay. Well, if you do, anything comes up, definitely give me a call. Okay?
Thank you.
Okay. Thank you.